Thank you. Deputy Healy.
Thank you, Kim Horla. Tánaiste, can I ask you, when will your government stop terrorising sick and elderly people across this country? Your government's austerity budget of this year has targeted the withdrawal of 40,000 existing medical cards from sick and elderly people across the country. That policy is now being implemented on your behalf by the Health Service Executive. And I can say to you, Tánaiste, that it is not possible for me to overstate the fact that sick and elderly people are traumatised and in daily fear of losing their medical cards. The postman or postwoman, who has always been a welcome sight for elderly people, is now a source of anxiety in case they're bringing that dreaded white envelope that says you're under review and the threat of your medical card being withdrawn. And let's be very clear what's happening, Tánaiste. What's happening is that sick and elderly people are being targeted by your government to pay banks, to pay bondholders, and to protect the 10,000 top earners in this country who are earning €595,000 per year each. These medical card holders are being specially and specifically targeted, and they're in their 60s, their 70s, their 80s, and even their 90s. Their cards are not due to be reviewed. They hold fully current, fully valid medical cards assessed and approved by the Health Service Executive with expiry dates up to 2020. But they are now being punished to satisfy the greed of bankers and bondholders. Tánaiste, do you think that this is fair? And will you do anything about it? Have you or your government any compassion for sick and elderly people? And will you immediately instruct the Health Service Executive to desist from punishing and hounding elderly people? It has always been the case, and I'll finish with this, Count Corla. It has always been the case that persons with medical conditions who require urgent or ongoing medical treatment have been qualified for discretionary medical cards. That, Tánaiste, has now stopped. And persons with cancer diagnosis and with, for instance, motor neuron diagnosis are now being disqualified from the discretionary medical card.
Thank you.
I'm sure you believe that that is unfair also, and I'm asking you to ensure that that stops and that the Health Service Executive are instructed to ensure that these patients get their discretionary medical cards. Thank you, Count Corla.
Honest.
There are more people today with medical cards than at any time in the history of the state. There are, I think it's currently around 50% who have medical cards. That is at a time when, as we all know, there has been extreme pressure on the public finances. It has always been the case that medical cards are renewed, are looked at. The approach, the government's approach, is that medical card applications should be looked at sympathetically. The medical needs, obviously the financial circumstances of the individuals and their medical needs, these are all taken into account. I think we all have the experience that there are individual cases that from time to time have to be pursued with the HSE about the issue of a particular medical card. But I want to assure you, there is no targeting of any medical card holders. The government is clearly determined that the medical needs of people in this country are met. That is why we have worked so hard to restore the country's public finances so that we can continue to meet the medical needs of people who need them. And as I said, there are more medical cards issued under this government than have been issued ever in the history of the state.
Thank you. Deputy Healy.
Tánaiste, you almost boast that the number of medical cards have increased. And so they have. But of course, That is far from an achievement. That is, in fact, an indictment of your government. It is an indictment of the austerity policies that have driven people out of work, that have driven people's incomes down, and that have put them under medical card limits that are very stringent and have already been reduced this year. So far from being an achievement, this is an indictment of the austerity policies of your government, and it's certainly not anything to boast about. You, of course, have done the usual thing. You haven't answered the question. I've asked you specifically in relation to medical cards which are being reviewed, which are not for review, and also the question of medical cases and the discretionary medical cards. You've chosen not to answer those questions, and of course that's a usual tactic here in this chamber. And I can say this to you, Tánaiste, you may very well get away with that here in the rarefied atmosphere of this Dáil chamber, but you certainly will not get away with it when you knock on doors for local and European elections next year.
Thank you.
I want to also ask the Tánaiste when the medical card income limits will be reviewed and increased. They haven't been increased, Tánaiste, whether you know it or not, since 2006.
Thank you.
And in fact, some of these limits have been worsened over the past 12 months, including the question of travel to work, which is not allowed and which is very discriminatory towards people living in rural areas where no public transport is available. I would ask the Tánaiste to immediately instruct the HSE to ensure that sick and elderly people are not targeted and that medical problems are dealt with on a discretionary basis, particularly for cancer and motor neuron cases. Thank you.
Honest.
Well, it's perfectly clear to me that Deputy Healy has raised this issue to make a political point and a political charge against the government and against the hold on a second. Against the Labour Party in particular. So I want to answer it in that fashion. You say we're targeted medical card holders to give the impression that the government is taking medical cards off people. I've told you that there are more medical cards have been issued under this government than has ever happened before. Fact. Secondly, you make. I can't deal with specific cases unless you give me the detail. You want to give me the detail of specific. You want to give me. If you want to give specific cases, we'll deal with specific cases. But that's not what you're doing. What you're doing is you're making a political charge. You also get up and you make a wild charge about losing jobs. Where the jobs were lost, Deputy Healy, was by the previous government. 250,000 in the 3 years before this government took office. In the last 12 months alone, over 30,000 additional jobs created in this country, and we have a lot more to do. The level of unemployment dropping for the first time since the beginning of the crisis, now down to 13.5% from over 15%. The numbers of people who are long-term unemployed also down from 9.2% to 8.1%. We have a lot more to do in that area. The bringing in of the youth guarantee to get particularly young people back to work, increasing investment in our country to create jobs, and yes, delivering better public services, including the delivery of more medical cards with less money available to the state. That is the achievement of this government, and we're going to continue to do it. And I know that every single day that you get an opportunity, you will come in, you will berate that, you will denounce it, because that is the political game that you are pursuing. Let's concentrate now, less on the political charges, and let's concentrate on the needs of the people of this country, which this government is delivering on.
Thank you.